Stress fracture. So firstly, looking at the risk factors, this includes the repeated activities such as running or gymnastics. Next, there is also the abrupt increase of the physical activity and the inadequate intake of the calcium as well as vitamin D. Also, in cases of decreased caloric intake, in presence of the female athlete triad, this includes the low calorie intake, hypomenorrhea as well as amenorrhea, and low bone density. Now, the clinical presentation. In case of the clinical presentation, it can be insidious onset. This is of the localized pain, and there can also be the point tenderness. This is at the fracture site, and the X-ray, it can be negative for the first 6 weeks of stress fracture. Now, how to manage stress fracture? Management would be by the reduced weight bearing. This is for up to 4 to 6 weeks, that's 1 to 1.5 months, as well as the orthopedic opinion must be taken regularly. This is for the fracture. In case of increased risk for the malunion, so the structures here mainly involve the anterior tibial cortex and the fifth metatarsal.